some encouraging news in the battle against COVID-19. Nationwide, the daily case average and hospitalizations have dropped after the lethal summer Delta surge, and nearly 70% of adults now fully vaccinated. And this week, an FDA panel recommended a booster shot for some Americans who received the Moderna or Johnson & Johnson vaccine. But there are lingering questions about mixing and matching vaccines, shots for young children, and upcoming holiday gatherings. Dr. Anthony Fauci is standing by. But first, the breaking news this morning reports that at least 17 American missionaries and their families and children have been abducted by a gang in Haiti. Our ABC correspondent Victor Oquendo joins us now from outside the Haitian consulate in New York City with the latest. Good morning, Victor.
Good morning, Martha. This is all according to an audio message from the Ohio-based Christian Aid Ministries, and it was first reported by the New York Times. 17 missionaries from the United States, including children, kidnapped overnight as they were going home after building an orphanage. The State Department saying that they are aware, but didn't have much else to add besides saying that the safety of U.S. citizens abroad is one of the highest priorities. The kidnapping is just the latest incident in a country reeling from an alarming surge in gang-related kidnappings, more than 600 so far this year. That's according to Haiti's Center for Analysis and Research in Human Rights. And that is just one crisis facing Haitians. The country still in turmoil after President Jovenel Moise's assassination in July and that devastating 7.2 magnitude earthquake in August that killed more than 2,200 people and destroyed more than 1,000 homes. Martha?
Thanks, Victor. Now for the latest on the COVID pandemic, let's bring in Dr. Anthony Fauci. Dr. Fauci, the FDA advisory panel unanimously recommended booster doses for the J&J vaccine, but the advice is for all people over 18 to get the shot, even after just 2 months. We know this vaccine was not as effective as others. So should those 15 million people who got the vaccine be concerned, given these recommendations?
No, not at all, Martha. I think that they should feel good about it, because what the advisors to the FDA felt is that given the data that they saw, very likely this should have been a 2-dose vaccine to begin with. So the idea of making a recommendation that people who originally received J&J should receive a second dose 18 or older with none of the restrictions about whether or not you're at a high risk or not at a high risk, is that everyone who received that first dose of J&J who are 18 and older should receive it. So I think that's a very good thing. And I think it's very favorable for those who have received the J&J vaccine. I don't see that as a problem at all.
But Dr. Fauci, the panel was also looking at new data that suggests J&J recipients may be better off getting a booster shot from the more effective Pfizer or Moderna vaccine. Is that a better solution?
You know, that is true, the data you referred to, that if you boost people who have originally received J&J with either Moderna or Pfizer, the level of antibodies that you induce in them is much higher than if you boost them with the original J&J. However, you're talking about laboratory data, which very often are reflective of what you would see clinically. But the data of boosting the J&J first dose with the J&J second dose is based on clinical data. So what's going to happen is that the FDA is going to look at all those data, look at the comparison, and make a determination of what they will authorize. Once an authorization is made, then the ACIP, or the Advisory Committee on Immunization Practices, that advises the CDC, will then make a recommendation of what people who have been receiving and have received the J&J should do. So it's going to be a process of authorization first, and then a recommendation after considering all the data.
And what do you think, Dr. Fauci? How would they be better off for all those people out there who took a J&J?
You know, Martha, I think it's going to be variable depending upon who you are. For example, a woman of childbearing age who would have almost no issues at all with a possible adverse event of myocarditis, which you see rarely, but you do see it with the mRNA vaccine, that person might want to opt for that approach. If you're a young man who does have that very, very rare risk of getting a myocarditis, you might want to take the J&J route. So really, I think it's going to be individual. So what likely will happen is that both the FDA and their authorization and the CDC will likely give a degree of flexibility based on the individual situation.
And the advisory committee also recommended a third dose of the Moderna shot for those over 65, just like the Pfizer shot as well. What's the timeline for expanding those categories to different age groups?
Well, that's going to depend. Well, that's a great question, Martha. That's going to really depend on the data that comes in, because what we're dealing with data rolling in real time, not only from the cohorts that the CDC is following, but also in real time, we're getting very important data from Israel, because as I've said so often, Israel is about a month and a half ahead of us temporally with their vaccination and with the data that they're seeing about the waning of immunity, as well as the advantage of boosting people at different age groups. So the data we're starting to see from Israel indicates that even in a somewhat younger group, for example, from 40 to 60, there's a real benefit in getting the booster shot. So what we'll be doing here in the United States, both through the FDA and the CDC, will be to following these data as they accumulate in real time, and any modification of the recommendations will be based on that data as they come in.
And as for children, I know you believe that it'll be early November before 5 to 11-year-olds can get vaccinated?
Well, the timeline, Martha, is that the FDA will be looking at the data from Pfizer. I believe it's October the 26th. They'll make a regulatory determination, and then likely the next week, which would probably be the first couple of days in November, then the CDC will do what they do. They'll have their advisory committee on immunization practices look at the data and make a recommendation. So I think the timeline that we discussed previously is really still on the timetable that we spoke about.
And Dr. Fauci, lastly, we know the best way to keep safe is to be vaccinated. But what are your guidelines for the upcoming holidays? Will you be giving out Halloween candy? What do we do Thanksgiving, Christmas, and the other holidays?
Well, Martha, I believe strongly that, particularly in the vaccinated people, if you're vaccinated and your family members are vaccinated, those who are eligible, and that is obviously very young children and not yet eligible, that you can enjoy the holidays. You can enjoy Halloween, trick-or-treating, and certainly Thanksgiving with your family and Christmas with your families. That's one of the reasons why we emphasize why it's so important to get vaccinated, not only for your own safety, for that of your family, but also for the good of the community, to keep the level of infection down. When you do that, there's no reason at all why you can't enjoy the holidays in a family way, the way we've traditionally done it all along.
Okay, well, that's very good news. Thanks so much for joining us this morning, Dr. Fauci.
Good to be with you. Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.